Well, good afternoon, everyone. I mentioned last week that Dr. Proton Rahman would be joining us today to update us on our projections for Newfoundland and Labrador. But before we get to that, I want to turn it over to Dr. Fitzgerald for our update today.
Thank you, Premier. Good afternoon, everyone. Thank you for joining us today. Since the media advisory yesterday, we have no new positive cases. The total number of cases in our province remains at 258. By region, we have 240 cases in Eastern Health, 8 in Central Health, 4 in Western Health, and 6 in Labrador-Grenville Health. 52% of cases are female and 48% are male. By age, we have 22 people under the age of 20, 38 between 20 and 39, 38 between 40 and 49, 56 between 50 and 59, 57 between 60 and 69, and 47 who are 70 and above. 5 people are in hospital due to the virus, and 2 are in intensive care. 221 people have now recovered, and in total we have tested 7,622 people. The 2 new confirmed COVID-19 cases in our province this past weekend, following a week of no new known cases, was not unexpected, but it is a good reminder to us just how unpredictable this virus is. COVID-19 knows no boundaries and can spread quickly. Despite the low number of cases we have recently experienced, we must continue to focus on preventing further transmission of this disease in our communities. This pandemic is frightening for many of us. There is much information out there that is confusing and sadly at times false. Fear and misinformation can make us behave in ways that we normally would not. Please consult trusted and reliable sources for your information about COVID-19 to ensure you have the most up-to-date and accurate information. Please remember that people can follow all the guidelines that we recommend and still contract COVID-19. Like so many respiratory viruses, this is very easily spread. People who contract this disease need our support and understanding, not our judgment and disdain. They are likely scared and sick. Please treat them as you want to be treated in the same situation. No act of kindness, no matter how small, is ever wasted. Please continue to protect your loved ones, yourselves, and our most vulnerable populations by staying at home as much as possible, especially if unwell, avoiding public spaces, maintaining safe physical distance from others, covering coughs and sneezes, and washing your hands often and well. As we are flattening the curve, people may think it's okay to socialize with family and friends, gather for special occasions, and resume life as it was. We are not there yet. Please continue to stay within your own protective bubble with your family. Planning with public health officials is currently underway to determine how and when we may relax some of the public health measures in place. As I know you all appreciate, COVID-19 is uncharted territory and the stakes are high. Therefore, we must proceed slowly with great caution and care. We will get there, but it will take a coordinated approach with the safety of all of us in mind. I'd like to remind employers that effective today, they are now required to submit a 14-day isolation plan for all workers from out of the country, such as seasonal farm workers, specialty trade workers, and critical maintenance personnel. These plans are complementary to typical workplace health and safety plans and procedures already required under provincial occupational health and safety legislation and must be fully adhered to by employers. Exemptions to self-isolation apply to workers who do not have COVID-19 symptoms in certain sectors. However, these workers must still self-isolate while not at work. For information related to exemptions and guidelines on developing self-isolation plans for out-of-province and temporary foreign workers, please visit gov.nl.ca/COVID-19. Please note that all other workers entering the province must also self-isolate for 14 days upon arrival. This may include, but is not limited to, for food service workers, healthcare workers, and retail industry workers. I would also like to remind the public that in addition to the order implemented last week requiring all travelers to sign a declaration upon entering the province effective today, all travelers arriving in Newfoundland and Labrador are required to submit a self-isolation plan to public health upon arrival. Details related to these orders are available online at gov.nl.ca/COVID-19. As a recap for those who may have just joined, we have no new cases since yesterday's media availability. The total number of cases in the province is 258. By health region, we have 240 in Eastern, 8 in Central, 4 in Western, and 6 in Labrador-Grenville Health. Together, we have worked incredibly hard with great personal sacrifice over the last number of weeks to slow the spread of COVID-19 in our province, and I thank all of you for your efforts. Moving forward, we'll take the same dedication and perseverance, and we must remain united, supportive, and compassionate. I know you, Newfoundland and Labrador, and I know we are up for the challenge ahead. Thank you.
Well, thank you, Dr. Fitzgerald. As Dr. Fitzgerald said, we've come off of 7 days of no new cases, and then over the weekend, some guidelines to flatten the curve. As mentioned earlier, joining at this table is with Minister Hagee, Dr. Fitzgerald. This afternoon is Dr. Proton Rahman. He is a clinical scientist at Eastern Health and a professor of medicine at Memorial University. He joined us earlier this month to provide us a breakdown of the various projections of this virus in our province. When this all started, we asked the Newfoundland and Labrador Centre for Health Information to bring together a team to help inform our healthcare planning for COVID-19 pandemic in our province. That team helps us plan and prepare for your healthcare needs. Dr. Rahman leads the core analytics team and joins us today to present their latest findings. During this pandemic, we've been telling you not to let up and not to be complacent, as every single move that you make determines our future. You will soon see that Dr. Rahman's presentation, there is good reason for the health guidelines that we have put in place. So I ask you to please pay very close attention as I now hand it over to Dr. Rahman for his presentation.
So thank you, Premier, for allowing our group to present at this daily briefing. So this really is a collective effort through a number of organizations with individuals that worked really hard, and I'm the spokesperson for that group. So what we'd like to do today is to give you an overview of the work that we have done, particularly as it relates to COVID-19 in Newfoundland, so Newfoundlanders and Labradorians can get a better idea in terms of the impact of this particular virus in our province, and also to provide some rationale through our results regarding the potential path forward. So specifically what we want to look at are the national and the provincial trends, the transmission source of COVID-19 in Newfoundland, some data modeling in terms of high-level results, de-escalation readiness in the sense of how ready are we in terms of relaxing the public measures, and some recommended further enhancements that will actually further protect our province. So in terms of national and provincial trends, so I actually started with this particular slide prior to the Easter presentation because it captures a fair bit in terms of the trajectory of COVID-19 in Newfoundland. So we initially had a rapid rise in cases, very swift public health measures, there was flattening of the curve, and through concerted effort and sacrifice among Newfoundlanders, you've really helped crush that curve, which is excellent. So we thank you for that. But it also is a testament to the public health measures that were actually implemented. And so you can see how non-pharmacological, good public health measures have slowed the spread of the virus, and our trajectory now is quite a bit different than it could have been as demonstrated by another province. Sorry, I'm just having trouble changing the slide. Thank you. So this shows us that most of the Newfoundlanders are recovering. This is the gray, which is excellent, and a few cases that are still active. So if you do have COVID-19, just let you know that 90% of Newfoundlanders, even though you're having symptoms, and it's quite an anxiety-provoking event, do well at home. Use your virtual social network, use your virtual primary care network, and most patients recover fully. For those 8 to 9% of patients that do not recover, the hospital is certainly there for you. Going to St. Clair's most days, I've realized they've transformed the healthcare system so that it's better now able to look after COVID patients, also to protect the healthcare workers, and look after cases that are not related to COVID. And so if you are having issues, urgent or semi-urgent, please go to your primary care network, because we'll look after you as well. The other thing that's quite relevant in terms of this particular slide, it shows that other than patients that are age over 70, that if you have 2 or more comorbid illnesses, you're more likely to have complications. So as a result, if you fall into this group, please be extra careful and make sure that your bubble protects you even tighter. Where is the COVID-19 coming from in Newfoundland and Labrador? So this slide really illustrates a couple of important points. First of all, there was a large gathering that resulted in a large amount of transmission. This is the rationale why large gatherings will be very difficult to do in the very near future. Secondly, it tells us that the other source of the virus is travel or contact related to travel. So we have to have a rational, respectful, but a very effective border control plan to stop significant importation of the virus into our province. So what is our data modeling showing in terms of high-level results? So as the numbers are small, the math and stats group in Memorial did a stochastic or a random approach, and there's great variability, but what they're showing is that the first wave is resolving, but still we're expecting to have a few more cases. So the smattering of cases that we've seen this weekend, for instance, is not necessarily unexpected. A slightly different approach is a deterministic compartmental model that to some extent is fitting the data a little bit better. And so what they projected some time ago is the issue related to the funeral home is resolved. And this is exactly what we're actually seeing. No more new cases related to the cluster from the funeral home. And then when you subsequently look at the projection based on travel and community spread, what you notice is that they're also projecting a slight increase, but overall the first wave in terms of infections is also subsiding. To talk further in terms of the modeling, a very key concept to understand regarding the virus is the reproduction number. So a reproduction number of 2.5, which has been attributed to the SARS-CoV-2 or the COVID-19 virus, means that if you're infected, then there'll be secondary infection in 2.5 individuals. So why is this important? This is a characteristic of viral transmission that occurs in terms of infections in a susceptible population. In other words, it gives us an idea of what's going to happen so that if your R0 number is greater than 1, then slowly the virus is going to propagate and at some point there'll be an outbreak. If, on the other hand, the R0 is less than 1, the epidemic will subside. So let's look at a hypothetical scenario. So we have gone through and been able to manage successfully, because of the public health measures and your cooperation, the very first wave. Because we're going to now follow some respiratory etiquette, let's just assume that the R0 going forward for the rest of the susceptible population is 1.2. Now 1.2 and 1 doesn't really seem that different, does it? But it's a 20% increase, and so 20% increase at each generation will eventually lead to a rise in numbers, and this rise in numbers is going to cause an acceleration, okay? And this exponential increase, when this occurs, is very hard to stop. Think of the wildfires in California and how hard it was to extinguish it when it actually started. So we must do everything to try to prevent this exponential spread, and the best way of doing that is to make sure that our R0 value continues to be less than 1. So what are the numbers right now? So the R0 actually doesn't really apply when the epidemic starts. In that time, we actually use a cousin parameter called the effective reproduction number, or RT. So when we actually look at the RT, there was an explosion of virus in our population. And then with the stay-at-home orders, along with other public health measures, you can see how the RT fell dramatically, and that's why the numbers are down. The only thing about the RT to be a little bit careful of is that there's daily fluctuations. So although it's very good in terms of showing trends, asking Dr. Fitzgerald about the RT every day is not necessarily reasonable. She's going to use this as a trend of how we're actually doing. So how is our readiness for reducing public health measures? That's what everyone is asking. They're asking that because they're following numbers. The most important thing to remember about our readiness, it's not actually about the numbers, because the virus is going to persist, it's going to be here for a while, whether it's imported through travel or it comes for some patients that are asymptomatic and then subsequently become symptomatic. The question to ask is, how ready are we when there are more cases? Can we test enough and test quickly within a day? Are we able to get most of the contacts in a timely fashion? Primarily before the contacts primarily having symptoms. Do we have enough personal protective equipment to open up our elective surgeries, for opening up some businesses? Do we have the hospital capacity in the sense of enough vacant beds in the ICU in case people get sick, and enough human resources? Our government, the health authorities, volunteer organizations like Task Force NL are really working hard to make sure that we have that capacity. Now let's look at the actual trajectory of the cases. There's no one size that fits all in terms of the metrics that are going to be used, although the Public Health Agency of Canada and others have made recommendations for which Dr. Fitzgerald will pick things that are appropriate from the province. But the elements that are there are similar, so if we can review some of them. Community cases, we've had 2 in the last 7 days. Sustained reduction in cases, we've had no more than 1 case per day in 1 week. We've not had a hospital admission over a week. We've had no deaths for over 2 weeks. And using a software that the Public Health of Canada uses, our RT has been less than 1 for over 2 weeks. So anyone that's actually looking at this, they'll say, hey, there's actually pretty good viral transmission control right now. It's part and parcel to your efforts and sacrifice, so we thank you for that again. Also due to the effect of public health measures, but this by no means is victory. The harder part is when you actually start to reduce the public health measures, when you start interacting, because you can lose control right away. Once the public health measures, are reduced, what do? We have to be very, very careful and diligent in terms of monitoring. There is a group of parameters that we're going to follow closely along with the Public Health Department. And each of these has limitations and benefits. And so the context is really important. So for instance, just take one of them, daily numbers, because that's what often people are focusing on. It's not necessarily the number. Situational awareness is the key. We need to know where they're from. Is it within a cluster? Can we actually contain it? So each of these have some intelligence behind it and has to be interpreted in the proper context. Some would argue that a harder outcome is actually ICU admissions, because that is what gets saturated and when patients get really sick. The thing to consider regarding ICU admissions is that it takes a little while between onset of symptoms and coming up with into the ICU. So what I mean by that, say there's a de-escalation in terms of public health measures. A week later, you come across someone that has the virus. Then it's not till at least 2 to 3 weeks after that you get sick, you get hospitalized, you come up to the ICU. So what's happening takes about 3 to 4 weeks to assess. So if you want to assess the effectiveness of public health measures, it'll take about 3 to 4 weeks. There are a couple other things that we're actually thinking about that I just would like the public to consider about further enhancements that are actually going to help protect our province. One is voluntary, consented, digital contact tracing. So why are we proposing this? Say an individual here has the virus, and they subsequently infect 2 other people, and they subsequently infect others in this hypothetical scenario. So there's 8 people infected altogether after the primary source. So if we can do proper contact tracing and then get down to 3 of those individuals, that means that's 6 individuals from the community spreading the virus. And what the modeling shows, and this is not our work, is that if you let this persist, about 40 to 50% of Newfoundlanders will get infected with the virus. If, on the other hand, you can identify at least 6 of these individuals, then the infection rate in the province will be about 5 to 10%. That is a huge difference in terms of volume of patients that are affected and the burden that's there in the healthcare. So the question is, how can we best identify at least 70 to 80, if not more, percentage of our contacts? So let me ask you a question. Do you remember the person that was in front of you at the checkout at the pharmacy 3 days ago? You may or may not, but if you had volunteered and consented to a digital contact tracing, it'd be another way of actually getting that information out, because it is critical to the health of our province. The other thing I'd really like to thank the government about is them embracing technology. So this is something that our group is proposing to them, which is using artificial intelligence to help guide public health measures. This has nothing to do with contact tracing, nothing to do in terms of privacy issues. So we were aware through the census, the population structure, the number of people, where they are, the illnesses that they have in general, know the size and location of schools, malls, hospitals, know the travel routes for most instance. And what we actually do is we model behavior and let people interact. And then we say, let's open up one sector versus the other. And what would the consequences be in terms of the impact of the environment? Sorry, the impact in terms of the infection rate. This is not a cure by any means. It's public health measures that reduce infections. What this is a way of assessing risk when there's no real consequences in terms of the actions. And then once we actually understand from public health measures what is the impact of each of these measures, we'll feed it back into the model. And so that is machine learning, and we'll refine and fine-tune so we can make really tough decisions. So this may not be ready for another month or so. So why am I telling you about it? And that's because if the virus is going to stay, and without a vaccine, we're going to be about maybe 1 to 2 years we have to manage with this virus being here. We need really smart solutions. We know that Newfoundlanders are creative. If we can be creative in trying to understand where the bottlenecks are going to be in our province, you can be creative in terms of your own businesses to come up with solutions so you can actually start living with this virus till there is a vaccine. So in conclusion, and very much because of all your efforts, there's very good control right now of COVID-19 transmission, even though we do have certain cases. And reducing public health measures at some point in the near future, I think, are reasonable. It has to be slow and it has to be phased. You need continuous monitoring, and that's what you really want to do, is to prevent a larger wave of infection as we see in Singapore. As Minister Hagee mentioned last week, there's no playbook for this, and so sometimes if you release things and there's increase in cases or there's increased burden in terms of the healthcare system, they may have to be a reintroduction of the public health measures, but we'll have to do it one at a time. And then just finally, as an anecdote, it was just a beautiful day yesterday. I went for a run, and I was just thinking as I was running, it's nice to see people out, but you have to remember to slow the spread. Please maintain physical distancing. It's really going to be the key as we start to reduce these public health measures. And then very similar to Dr. Fitzgerald, let's use proper sources of information when we think about this virus. Thank you again, Premier, for allowing us to present.
Well, thank you, Dr. Rahman. And certainly I think we would all agree that if there's anything that Newfoundlanders and Labradorians are known for, it's their creativity. And so there's also, we know that there's value in using technology as we protect ourselves during these uncertain times. We also know that the information that you have shared with us is always subject to change based on, us in our province, how we follow the guidelines. So the message, I think, for all of us is we must continue to stay the course. And although the projections themselves may not be certain, what is certain is that all of us are subject to the COVID-19 virus. and that everyone can transmit it, and it has no boundaries. Doesn't matter what's gender, doesn't matter what's postal code, it really doesn't matter which community you live in, and that no one is invincible. It's going to be in our province for many months, as Dr. Rahman has said. So what it comes down to is really, how are we going to adjust our lives and our workplaces? And how can we safely live with COVID-19? This is not something that we can wait out. We must adapt. So while we wait for the vaccine, we must adjust and adapt to what is a new normal. Collectively, with our shared strength and determination, we will get through this together. But in order for us to have any sort of future, we must remain vigilant and not let up. So I too want to thank you for your efforts. I will now turn it over to Minister Hagee for his comments.
Thank you very much, Premier, and thank you, Dr. Rahman, for your help with all of this. It's certainly providing us with something of a beacon. I was reminiscing today that it was actually the day of the debrief on the snow event in St. John's that we first started looking at planning for this pandemic. We're actually now into day 50, a landmark in some respects by numbers of our public-facing COVID pandemic control. I want to just take a moment to also acknowledge it's another week to mark and celebrate the achievements of medical laboratory technologists. And given all the comments recently about testing and testing capacity and the needs of the province as we move into a new era of public health measures, I'd just like to shout out to the medical lab techs who've helped me over the years and are now helping everybody through this really difficult time. And there'll be information on our website, on the Department of Health, marking some of the achievements and some of the services that are provided by medical lab techs across the province, from the simple ones you may be familiar with for blood testing and blood draws, to some of the exotic things they've ended up helping me with in intensive care units in the night over the course of my career. So thank you very much to all of you. Dr. Rahman's presentation is helpful, it's informative, and it shows us that the work he's done can be validated by two independent methods. And essentially what he's done is he's presented us with two wrenches, two tools for our toolbox. One is an ability to assess when we might be ready as a province to say things are under control and getting better for this wave. What can we do to relax a little bit and prepare for the future? And the other is some dials, some measurements to say, once we do that, how are we doing over the course of the next 3 to 4 weeks? He's also given us a time span, in the sense that if we do make changes, how long do we need to wait before we do anything else to be sure that we haven't set ourselves back and that the decisions we've made have been sensible and justifiable? Because as I've said, and he reiterated, there is no playbook for this virus. It is unpredictable. It is contagious in a way we haven't seen with other viruses for a long time. And for some, it is quite a deadly condition. So the science evolves almost weekly around this, and we need to keep an eye on that. So from the point of view of the crucial things that we talk about at these briefings, again, it's reinforced around testing capacity, around old-fashioned public health and contact tracing, but also he's introduced concepts around digital contact tracing, which will bring this very much into the 21st century. And in actual fact, I would argue, lead the country in some of these if they come to fruition. And I'm, as they say, cautiously optimistic that will happen in the near future. But we've also talked about bed vacancies in intensive care and these kind of human resource issues where we need to have the staff for those. So these are things that we focus on every day. I bring a little sheet of numbers with me to supplement Dr. Fitzgerald's for the media, because they often have, quite rightly, questions about the system and its capacity. Dr. Rahman used the analogy of the wildfires and said that how fast they spread when they get beyond a certain point. Well, if the first wave could be considered under control, I would argue we're entering a phase of embers. And everybody knows how easy it is for these things under the right conditions to start up again. Distancing is going to be the key to avoid fanning those embers into little local fires or clusters. And this is going to have to be a way of life, because we have to prevent and reduce the risk of subsequent waves. And the only way we're going to do that is by these kind of public health measures that we are using at the moment. Because of this virus's unpredictability, because of even discussions now as to whether a vaccine that is produced for COVID-19 will work if COVID-20 emerges, we really have to think about an 18-month to a 24-month marathon, not a sprint. A vaccine may come, it may be usable, and it may work against this virus. But this is a sneaky little devil, and you really don't know where it's going to go next. So again, physical distancing, a mask if you can't physically distance, make a bubble for yourself and your family, stay in your bubble, and don't burst anybody else's. That has to be our way of life in Newfoundland and Labrador, and I would argue across the globe for the next little while. So with that, Premier, I'd hand it back to you. Thank you.
Well, thank you, Dr. Hagee. And I think we all agree that this will be one of the largest challenges that we have faced in our province, and we are very fortunate, as the Minister has just said, that we have a great team of healthcare professionals, and today we celebrate, lab technologists. And for me, it reminded me of my brother, who was a lab technologist in Western Newfoundland for many years. So we're very fortunate to have so many great healthcare professionals, including a lab technologist, working with us. So we'll now take this opportunity to turn it over to the media for today's questions.
Thank you, Premier. For the benefit of our speakers, we have 7 reporters registered for today's call. In the essence of time, each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they were registered for today's call. We will run through the telephone queue, and I will call each reporter by name. Please do not press *1 until your name has been called. Our first questions today are from Ben Murphy of VOCM News. Please go ahead.
Thank you. Minister Hagee, essentially this updated report today says we are okay to relax on some restrictions due to our recent numbers. Are we now any closer to a date in which public health will allow the restart of some elective surgeries and procedures?
Certainly that's top of mind for the RHAs, and I would argue that once they had got their public health measures well in hand and stabilized, that to a varying degree across the province, they've been looking at what happens next, and reopening those kind of things is certainly top of mind. I think you will see, building on Dr. Rahman's work now, a development and bringing forward for everyone a plan similar to you've seen in other provinces as to what, from a public health point of view, makes sense in terms of doing things next. Certainly, other government departments will have their own view on their own bailiwick in terms of TCII and business and hospitality and those kind of things. But from the health point of view, certainly bringing in to action measures to reduce the backlog of people who've had to wait is certainly top of mind.
And Dr. Rahman, back to one of the slides, scenario forecasting based on an RO of 1.2. It shows that really big spike starting in about a year from the onset date in early March. Can you kind of just go over this and explain this again? And is this something we're expecting and planning for, this big spike about a year from now?
No, this was a hypothetical scenario, Ben, and so we just made an assumption that we're going to continue with some public health measures, and the question is, if you were to have a hypothetical reproduction number of 1.2, what would it look like in terms of the future? And so slowly, with each generation of contacts, the number of cases are increasing by 20%. And so this is just a mathematical model to show that with time, you're going to get into an accelerated phase and then an exponential phase. We're going to get a lot of infections. And it was really being used as a reminder that what we should really try to do as a community is to keep that R naught value less than 1, and to titrate it as best as we can as we start relaxing public health measures. This was not trying to provide timelines or give an estimate of the magnitude or duration of the peak. This was just showing that we need to keep good control at the present time, or else there will be acceleration at some point in time.
Ben,
Thank you.
Ben, what it means in practical terms is if you have the virus and you pass it on to more than one person and everybody does the same thing, that's the graph you'll have of case numbers within a year.
Okay, thank you. And Premier Ball, there has been quite a bit of action in the fishery in the last 24 hours. The FFAW now blocking out of province crab from landing here due to what they say unsafe conditions around COVID-19. They're calling on the provincial government to step in and prohibit this. What is government doing in this situation?
So right now, this is about the safety of workers and a safe workplace for anyone, at any processing site. And it's important that, we get this right as well, because there's a lot at stake as we take measures to reopen the economy and get people back to work. So any employee who feels that it's not a safe workplace, well then they should not go to work. It's as simple as that. So what I know about the processing plants that are receiving product from outside our province, which is not unusual. This is something that's been happening for many years and has complemented much of the fish processing within our province. We have plants open in Quebec, in Nova Scotia, New Brunswick, and PEI. So there's been orientation plans that have been shared with those plants that are about or looking at receiving product from outside the province. So first and foremost, it's about safety. If people are not comfortable in going to work, then they should stay home. But for those that want to go to work, there's a number of measures that have been taken, put in place, orientation, new PPE, and there's been some sharing of plans with Service Newfoundland and Labrador. And as my understanding, they meet the guidelines. And so, but it's safety first. If you're not comfortable in going to work, well, then you can stay home. And all the processors have said, from what I know, is that there'd be no ramifications, there'd be no loss of benefits in terms of seniority and so on. So the workplace must be safe if you decide to go there.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Dr. Rahman, this is going to be directed to you, but in looking at your presentation here, you touch on digital contact tracing and using artificial intelligence to guide public health measures. What do you say to people that said, that's too much, Big Brother's already looking over me, I don't need more of that?
It's certainly a fair question, and things have to be weighted. So what you're trying to do is to protect health and also privacy and also issues related to justice, and try to strike the right balance so that we can actually keep our province healthy and not infringe unnecessarily. And so if anything were to come through in terms of the voluntary consented digital tracing, it has to be done with the consent of the individual. And then they themselves will have to look at the risks and benefits in terms of, it can certainly help with your health, it can help with the health of your neighbor, it can help in terms of the societal benefits. And so then you have to weigh the pros and the cons of the risks in terms of invasion of privacy. Both are very valid, and the checks and balances have to be right, and that's why the Department of Justice and the Privacy Commissioner will have to weigh in on issues like this.
Thank you. And Dr. Fitzgerald, this weekend with 2 new cases announced in the Eastern Health Region, is there any more information about those cases, to how they came to be in the province? Were they from travel? Are they Curl Lake related? Do we know any more information?
We do know that one case was as a result of contact with a known case, and I believe the investigation is still ongoing, so can't comment on both.
Okay. Premier Ball, I believe it was April 17th or in that week, you had said that there was work being done on dispensing fees and there'd be more information on that. I'm wondering if we have an update. Not everybody falls into the programs provided for by the province, and we're seeing other provinces begin to lift the 30-day restrictions?
Kellyanne, that's a good question. Nova Scotia, in actual fact, has followed our lead and done exactly what we did. We have a responsibility to our NLPDP clients, and we can determine within a broad range how that's managed. And we have managed that, and we've been prepared to put what is an extra $7 million into the budget there. Outside of that, we actually do not have any levers to set prices in what is essentially a private market. We have, however, engaged with the pharmacy board, whose decision this was to go down this route based on information in turn they had about drug shortages. But my department and myself are arranging a meeting with both the pharmacy board, who are the regulators, and the Pharmacists Association, who are the representatives of the pharmacists, to see if we can find a way out of this. As an aside, but relevant, is we've had information from drug wholesalers that in actual fact the supply situation in the short and medium term may actually ease. So it may well be that there would be a resolution to this in the very near future. I noticed New Brunswick last week said they were going to work on this, although it was a declaration of intent rather than actually a substantive change to what they're doing with their drug plan.
Thank you.
Our next questions are from Peter Jackson of the Telegram. Please go ahead.
Dr. Rahman, the presentation that you've given this week, it differs a fair amount from the last one in that it has very little in terms of long-term forecasting, other than the one scenario with R0 of 1.2. Is there anything about the first presentation you gave that informed why you would sort of stay away from the projection scenarios that you had in the first presentation?
Yeah, so that's a really good question. And so when we first looked at our first scenario when we were modeling, there was some cases that had actually occurred. There was patients that were there within the hospital, within the ICU. And so it was, even though the numbers were small, it was possible to model somewhat future projections. And then what happened over the last week is that there were no further admissions, hospital admissions, there were no ICU admissions. And so if you were to look, for instance, the modeling that was done in British Columbia, they used an anchor for ICU admissions. There was a tendency for it to go down, and then they gave scenarios of what would happen if it go down quicker, or if you did not follow public health measures as much and it would go up. But because we were pretty much in a flat line, it was really hard to model right now because there's very few cases. And as a result, it's not possible to forecast when you have very little deaths, very few new cases in terms of hospitalizations, as well as the ICU. So the most responsible thing to do is to short-term predictions in terms of capacity, and we actually provide this to our RHAs, and that particular modeling has been relatively accurate in terms of what their burden of disease would be in terms of hospitalizations and in terms of how many patients there'll be in the ICU. And just for the related to time, I actually didn't show that today.
Okay, thank you. Dr. Fitzgerald, someone made note on the weekend that of the 16 new cases that we've had since April 23rd, or April 13th, we've had 16 new cases, yet of April 27th, there were 36 active cases, which means somewhere in the line of 20 of those cases must be at least 2 weeks old. Is this typical for a disease to last this long?
Thanks for that question, Peter. It depends on how we are testing or how we were determining that somebody is recovered. So for people who have mild disease, who are 10 days out from their symptom onset, so when their symptoms first started, they are considered recovered, provided their symptoms are now resolved. If somebody was sicker than that, say they were admitted to hospital or ICU, we need to have 2 negative swabs in order to consider them the condition resolved. And the reason for that is because when they're sick, they tend to have higher viral load, so they have more virus in their system, and we need to make sure that that virus is really cleared their system before we can say that they are resolved and now can go out in the community and carry on as they did before. So that's the difference. We also have that same criteria for healthcare workers because they are going into vulnerable populations, and we want to make sure that they do not have any virus in their system if they're going in. So it can take quite some time before we get those 2 negative tests in a row. And certainly we've been seeing that not just here but across the country where we have to go several weeks actually for some people before we actually get those 2 negative tests. So they would still count as unresolved cases, right?
Right. Yep. Because it's testing rather than symptom testing.
Yes, exactly.
And one other question for Premier Ball. The federal government has passed legislation to top up wages of personal care workers. And I'm just wondering whether you expect any of that to come here. How do you see it rolling out?
Yes, there's been a lot of discussion around the program that would support essential workers like healthcare workers and others within our community as well. So this will be a cost-shared on a cost-shared basis with the federal government and with the provincial government, and this is something now that as we finalize the details that we'll be participating in as a province, and we'll take the opportunity to join at that cost-shared ratio to support essential workers in Newfoundland and Labrador.
Okay, thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
This is a question for Mr. Hagee. The prospect has been raised of digital contact tracing. Is this something that the province is going to move forward with, and how quickly could you see that getting up and running?
We've had discussions both at the national and the provincial level with local entrepreneurs as well as nationally sourced open source software about both of these elements. We see this as a tool. It's certainly been used in jurisdictions that have been touted as being excellent in managing this. I'm thinking South Korea and Singapore. Obviously, Dr. Rahman's already alluded to the privacy issues. And it would be obviously an opt-in mechanism. How soon? We're actually in discussions with a local company as well as on the national level, and we think we could have something up and running within a couple of weeks.
Dr. Rahman, you said in your conclusions that the situation is to the point where we can start to look at relaxing some measures. What do you think are some of the measures that would present the least risk at relaxing?
Those are really good questions. And so the reason why I say that is that we're actually following the data, and what the data shows is that the first wave, the peak has actually occurred and it's starting to subside. And so the transmission metrics that are actually there now is showing that things have actually started to settle, which is actually quite good. And so this is sort of where the thinking is coming for in terms of that particular recommendation. So then you have to think about, so where is the risk? So the risk occurs if there is a high amount of contact, or in a business where there is intimate contact. So for instance, things like a hair salon, or if there is a business that's going to have a hard time modifying either of those two, which is a high volume or intimate contact. So there's 3 things that you worry about in terms of risk is, can you physically distance properly? And if you can't physically distance, can you protect yourself and your client in terms of having enough PPEs? And so there can be risk assessments done for each of the businesses, and then you can sort of categorize them in terms of low risk for contact, low risk in terms of the number of individuals there, or physical distancing. And then you look at your risk level in terms of how well you can actually adapt to a change, and then subsequently have a gestalt of what is possible to do first as compared to later on.
Thank you. And Mr. Hagee, if groups larger than 5 are banned, are the fisheries protesters that we're seeing right now on the West Coast and Central breaking the law, and could they be charged?
whether or not you're breaking the law is not a decision for a politician, but if they can't keep 6 feet apart, they may find themselves subject to an order.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Just like a little bit of clarity, you mentioned at one point about the possibility of reducing the spread of the virus in Newfoundland to something like 5 or 10%, if we're able to identify as many cases as possible. I just want to make sure I understood that correctly. And you said we'd have to, at that point, have identified 70 or 80% of cases. Is that right?
Yeah, so this comes from a model from the Public Health Agency of Canada in the modeling group. And so modeling you have to be a little bit careful of in terms of some of the projections that go into it. And so what they had shown is that if you are able to identify a lot of your cases, that's just not enough. What you also have to do is identify the contacts. And so when they looked at the efficiency of trying to identify contacts, if you can't identify more than 30% of your contacts, that means that the virus is going to spread within your population. And then if you let it spread for a while, what it's going to do is going to infect around 40 to 50% of individuals. If on the other hand, hypothetically, you can identify at least 70% of your contacts, that means there's less people out there infecting other individuals. It's going to spread less in your population. So what's really important there is the concept that you want to get as many contacts as possible, because if you can't get the contact that's infected and then quarantined, they're going to spread the virus. And what's not as important is the actual number in terms of proportion of individuals that are infected, because that was just done with modeling under certain assumptions.
And is there any way of measuring how effective we've been at doing this so far?
So to date, I don't have an exact number, but we've certainly been well in excess of 90% of contacts being traced and contacted.
Thank you. Premier, one question for you. The FFAW wants the province to stop fish processing activities until an agreement has been reached between fish processors and the union for price for crab and also for safety procedures. Are you prepared to do that? Is that something that you're looking at doing?
So these are two separate situations. One is the pricing of crab, which is set by an independent pricing panel, which will meet, I understand, by midweek and before the season opens for the harvesting sector. Well, then those pricing mechanisms must be determined. The idea of opening plants for processing is a separate issue altogether. And what we're talking about today is something that's been happening in our province for quite a number of years. Matter of fact, it's led to maintaining some plants in communities, such as Triton as an example. So there have been some plans that have been put in place. It's really about COVID-19 being around our province, being around many of the industries that will be impacted into the future. So it is about adjusting. It is about adaptation. And, so what happens there is that we want the workers in these specific communities to be engaged with the processors and make sure that they're comfortable if indeed they decide to go to work. If they do not want to go to work, they must be able to say no. They're uncomfortable and therefore they would stay at home. So this is really about giving people the choice that would want to go to work in the fish processing sector in some communities. Each plant will be specific. Some plants will be able to adapt better than others, but first and foremost, it's about the safety of those plant workers. And if they're not comfortable in going to work, well, I would encourage them to stay home.
Thank you.
Operator, we have about 4 minutes left on our call. I'd ask you not to end the call at 2:59 so we can get the questions in from the final two reporters. Next up, we have Holly Mackenzie-Studer of the Canadian Press. Please go ahead.
Bit more clarity on how the digital tracing would work. Like, does that look at people's location history or their social media? And a bit about kind of how you would go about getting consent from not only the patient but also the people that their digital tracing reveals they were in contact with.
There's a very interesting set of discussions to be had around that, and there's some new technology that will collect that data and only unlock it with authorization from the individual who then is subsequently identified as positive. It involves low power Bluetooth and proximity. and then in turn that would give other people the option of being notified if they had been in proximity to someone who'd been a contact, and then they in turn would then authorize using codes the release of their contact list. Basically, it's what a constituent of mine suggested to me 6 weeks ago. Keep a diary of everybody you stood next to for less than 5 minutes. What it does is it uses cell phones to identify individuals rather than the guy in the grey jacket, 6 paces ahead of me in Dominion. That would be how that would work. It would be an opt-in system, as I understand it, and it would be consent-based. The evidence from South Korea and Singapore is that to have an impact, you needed on at least 60% of cell phones in the province for it to have its advantages. It's not, however, anything other than a fancy way of doing what Dr. Fitzgerald's team did with the funeral home outbreak. And one of the answers to the previous questions, essentially, is that the reason we are in the good place we are at the moment, apart from the ability and the willingness of people to do as they've been asked, is the fact that our public health system functioned exactly the way it should.
So you mean that, say, everyone would get a letter or an email or something asking to opt in or opt out kind of before this is rolled out in order for it to work?
It would be an app you would download and you would choose to either use it or not. If you didn't want to, you wouldn't have to.
Okay, and can you say the name of the local company that's working on this?
I think for the moment that's probably something I should ask them about first.
Our next questions are from Elizabeth Whitten of all Newfoundland Labrador. Please go ahead.
A lot of my questions have already been touched on, but I'm curious, how many people are currently self-isolating in the province?
We have data only on health service employees, staff. Currently, the number self-isolating across the province is a total of 114. That doesn't include people who have voluntarily, well, now been mandated under orders because of travel. These are people who have been identified through either symptoms or contact tracing as healthcare workers. We haven't easy access to that other set in terms of people who, say, for example, came back from Alberta or something 2 or 3 weeks ago before the data collection was mandated.
Right, and now that it's mandatory that people have to self-isolate when they come in from, say, Alberta, will those numbers be collected?
Oh, the information is being collected. Certainly, it's a semi-manual process at the moment, and it's done through public health.
Great. And Dr. Rahman, I had a question. Why not include an estimation on potential deaths in these certain types of scenarios?
That's a really good question. So the number of deaths that we've had to date has only been 3, so it's in some ways hard to give proper estimates, and the variability around it would be quite large. So we had estimated before in our first presentation that the number of deaths in the best case scenario would have been 9. There's 3, and we're nearing the end of the month. And so you can see that most of the projections have overestimated the number of deaths. I just didn't think at the time it would be responsible, given the large ranges that there are in doing the estimation with such small numbers. So it's a decision that we made as a group that unless we're more secure about their numbers and just seeing the large variability and the actual cases, there was such a discrepancy that really not to talk about that particular outcome at that time.
Perfect. Thank you so much.
Thank you very much for tuning in. The time for questions has ended. Please join us again tomorrow at 2 p.m., 1:30 in most of Labrador. Have a great evening.